Spinal cord injury, it has huge impact on the physiological and psychological aspect of the human life. And as the neurological pathways are involved, it causes, apart from the physical dysfunction, it causes the direct and the indirect sexual dysfunction as well. And as the sexual dysfunction is not very much addressed, like this is what I have seen in my clinical practice of past few years, that I have seen women and the men both with the SAI committing suicides, having divorces, and falling into depression and anxiety, with low self-esteem, that actually interferes with their physical rehabilitation program. So and that could be because that varies from the country to country, depending upon their social, cultural, and spiritual aspect. So I strongly feel that there is a need to address the sexual health concern, which is unique to women with spinal cord injury. So, like I said, that neurological involvement can cause the direct sexual dysfunction, and there are basically two pathways that are involved, and the involvement of these pathways can actually interfere with the arousal mechanism of the sexuality, that involves the orgasm, the lubrication, and yes, basically these two aspects. So one of the reflex that is involved is the psychogenic reflex. So psychogenic reflex is basically mediated by the sympathetic nervous system, and it happens at the level of the T11 and T11 and L2. So any injury, if happens above this level of injury, then the patient, or the SCI patient, can have the stimulation of the genitals area, that can cause the lubrication and can assist in the sexual function. So this is mediated by the sympathetic system, and like it is basically the segment that is involved is the T11 and L12. If you apply the pinprick on any other sensation on that dermatome, that can also stimulate the genital area via the brain spinal cord pathway, and cause the lubrication and can assist in the sexual functions. The psychogenic pathway, basically it works on the arousal and fantasies. Any psychological aspect, like the mental stimulation, can cause the trigger for this psychogenic reflex. The reflexogenic pathway, it is mediated via the parasympathetic nervous system in response to the sensation of the touch. So this is basically the spinal arc reflex. So the direct stimulation of the genital areas can via the S2 S4 segment, can cause the direct stimulation of the lubrication and organism in females. So, a woman with a spinal cord lesion above T11 may not be able to experience the psychogenic vaginal lubrication, but can still have reflex lubrication. So, the crux is, depending upon the level of injury, we could guide the patient on the particular sexual stimulation technique, that which pathway is intact in a patient. We can ask the patient to go through that program only. So this comes under the primary sexual dysfunction. Now next comes the secondary sexual dysfunction. So secondary sexual dysfunction means that, the involvement of the neurological pathways causes some other issues in the spinal cord injury, that indirectly affects the sexual function. Out of that, the first one is the urinary incontinence. So urinary incontinence is like the dribbling of the urine. Basically, it could have a huge negative impact on the self image, as there could be the leaking episodes could take place during the sexual activity, and it also causes bad smell, and it can cause the increases the risk of the urinary tract infection as well. So in considering the incontinence part, it actually has a huge psychological impact uh, on both the partners, with or without the SCI. So there are certain measures like the intermittent catheterization and use of the indwelling catheter to actually empty the bladder before the start of the sexual activity, that could actually help in dealing with the problem of the incontinence. So if we can guide the women on this, then yes, yes, hello, no, no, they're moving.
मैम उसको ना उसमें कर लो.
Yes, this is the, see, it's moving. This is I think this is the fourth or the fifth slide.
मैम सुनो, उसको एस्केप मोड में करो और वैसे ही चलाओ, तभी चलेगी.
Now is it visible, ma'am? Now is it visible, ma'am? Okay, so I actually I'll take it out from the
slideshow.
slideshow. Just wait. Okay, 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 okay. Okay, so I was, where was I? I was at the intermediation phase. Yes, so intermittent catheterization and the use of the indwelling catheters before planning the sexual activity could limit the accidental episodes of incontinence before during the sexual activity. Also, there are certain pharmacological alternatives such as the anticholinergic medicine that basically reduces the detrusor overactivity. So basically, the incontinence is because of the overstimulation of the bladder. So such agents can also help for the same. Next comes the bowel incontinence, like the urinary, the bowel incontinence, and the accidents are also very common. And the basically they are dealt with the use of the digital stimulation of the anal canal, which is used by maximum percentage of the spinal cord injured. Use of the rectal and oral laxatives can also be beneficial before any sexual activity to prevent bowel accidents. Next comes in, sorry, next comes in the secondary dysfunction is the spasticity. As we know that spasticity, the increase in the tone can actually cause a lot of pain to the patient, and it interferes with the sexual positions, because of which the partners are not able to go ahead with the sexual intercourse. So if a spasticity can be targeted well, if the medications for the spasticity and the physical therapy for the spasticity is given to the patient, and then also such episodes can be decreased. So localized spasticity may be treated with the botulinum toxin, which helps in reducing spasm and improve function, and use of certain oral medications like baclofen. Like I have seen, like I myself recommended a lot of baclofen to the patients who got spasticity, and we recommend them certain doses that they can have before planning the sexual intercourse, and that really helps during the entire process. Next comes the vaginal lubrication. This is another secondary dysfunction which is encountered by more than 20%, 23% spinal cord injury women. And it can be dealt with many pharmacological and non-pharmacological means, like using the lubricating jellies, and certain electrical stimulation devices are also there. Then that can help the women for with the vaginal lubrication, because if the lubrication is not complete, or if it is not efficient, then the risk of the vaginal injuries are very common, that can trigger the autonomic dysreflexia in many females. So we have to consider this thing, that we are dealing with the spinal cord injury women. So such minor accidents can cause fatal episodes in the spinal cord injury, so that needs to be taken care of. Sorry, yeah. And the next secondary dysfunction is the autonomic dysreflexia. So as we know that the autonomic dysreflexia is the high drive sympathetic activity that because actually occur when there is a noxious stimuli below the T6 level of injury. So what happens whenever there is any noxious stimuli, any painful stimuli below the level of the injury, that actually triggers the oversympathetic activity. And in case of an SCI, that could be the blocked catheter, that full bladder, or like I discussed, any vaginal injury during the intercourse. that all can actually trigger the autonomic dysreflexia in a female patient. So we have to educate the patient about the autonomic dysreflexia. If any signs and symptoms that basically include the hypertension, excessive sweating, and pain in the chest. So, if any such symptoms a patient noticed during the sexual activity, then they should immediately stop it, sit upright, and loosen any tight clothing if it is there. So, the education actually plays a very important role of the concerned rehabilitation professional and the education of the patient as well. Right, the next slide. Yes. Now we'll talk about the tertiary dysfunction. So, the tertiary dysfunction is basically the psychosocial factors that actually influence the sexual activity life of the SCI women. So the psychological aspect actually varies. Like I could better tell about what I have seen in India. Maybe in the Western countries it could differ, but yes, in what comes in the psychological aspect is the sense of rejection, like not able, the psychological aspect that they're not able to satisfy their partner, that they're not looking good, that they're on the wheelchair, that they have the bad smell of the urine leaking every time using the catheter, and the fear of rejection from the partner. All these actually cause a lot of depression, which is a very common cause of problem with arousal, because if one is in the depression, then you cannot work on the arousal aspect of the female patient. So people actually frequently experience grief, despair initially after the injury, which is further deteriorated by social anxiety and use of substances. Society outlook also towards a woman who got the spinal cord injury is very different, and the social pressure, extra load in the responsibility, the limiting options of the romantic partners, all these together can have huge impact on the psychological aspect. This is what I have seen personally as well. On any good day, if we don't look good, we feel bad, we have that, mild anxiety, oh, I'm not looking good today. But if we could actually imagine that what a woman who got spinal cord injury go through when they have to deal with so many aspects, it actually reduces the confidence of a woman that needs to be addressed, like significant insecurities with body image. So this all is the same. So yes, these all are the tertiary dysfunction. So basically, primary, secondary, and tertiary dysfunction are the main sexual dysfunction, direct and indirect, that we all as a health professional should be aware of dealing with the spinal cord injury. Now comes the sexual rehabilitation part. Like we know, the rehabilitation is not a one-person job; it's a multi-disciplinary approach. So everyone has to contribute in it. So when you have to contribute in it, you must be aware of what you are dealing with. So in what comes in the sexual rehabilitation, that I have also seen that more information during the initial rehabilitation. Actually, the sexual aspect of the spinal cord injury is least discussed during the initial time frame of the injury. So a lot of focus is on the surgery, on the ADL aspect, another aspect. So I think if the information could be provided about the sexual counseling could be provided in the initial phases of the rehabilitation, that actually can really help in lot many factors. Then continued opportunity for sexual counseling. Many patients they got to know about the sexual counseling aspect once they are getting a discharge. So many of them, they need the home care rehabilitation professional who can guide them on the sexual counseling part. Peer counseling, yes, those who are suffering from the those who have same struggle, suffering from the same problem, same issues, when they talk to each other, they can share a lot of knowledge, and yes, they can share their own experiences that could be very helpful. Very helpful. Education on the gynecological issues is another very important term. uh, Next, I'll be discussing about the role of physiotherapy in the sexual rehabilitation. Like I said, that one should always follow a multidisciplinary approach when it comes to the sexual rehabilitation. Lack of knowledge and hesitation to talk on sexuality invokes less participation of healthcare professionals during the sexual rehabilitation. So the taboo is not amongst the non-medical people of the society. It's the medical professional as well. They hesitate, and they also consider it as a taboo, that I have seen in my professional setup. So it is very important that they should understand, because a physiotherapist spends a lot of time with the patient. Either it's a complete or an incomplete spinal cord injury, a physiotherapist will be there throughout the journey of the patient. So if a physiotherapist is not aware of the physical and the psychological and the sexual implications of the spinal cord injury, and cannot talk to the um, concerned patient on the same, then yes, that could actually be of great help if you could actually discuss about this, and if your patient can discuss on the sexual aspect with you. So like we say that how physiotherapy could help in the sexual rehabilitation. Like as we know that in like because of the spinal cord injury, there is a muscle weakness is there, the movement limitations are there, that could actually restrict the options for the proper positioning during a sexual activity. So every patient is different, every injury, the level of injury is different. So a physiotherapist can actually aid in providing the pillows, or assisting in providing a particular position that could be helpful during the sexual activity period. Like wedges can be placed to help achieve and maintain a desired position for people affected by weakness or movement limitations. Other assisted devices can, like the sliding chairs can be used, that can provide the pelvic thrust during the sexual activity. That can also be very helpful for both the partners. Like spasticity and pain, like we discussed before, um, interferes with the sexual activity part. So, reducing the spasticity, providing massage, hot therapy, electrical stimulation. There are list of therapies that could, if provide to the patient, and they can be guided to maintain that on their own before the sexual activity. That can help the patient a lot. Sorry. A warm bath can be taken prior to sex. Massage and stretching can be incorporated into foreplay to ease spasticity. Like I said, to improve mobility, encourage proper positioning, to reduce spasticity, the use of the assisted devices, and to improve the vaginal lubrication. There are many electrical therapies that are being used nowadays in women with or without a spinal cord injury as well. So there is one stimulation that is called as transcutaneous tibial nerve stimulation. So the tibial nerve stimulation, basically the tibial nerve, it shares the same root value as the pudendal nerve, that is the S4 S5 segment. So when we stimulate the tibial nerve, the pudendal nerve gets stimulated, which in turn initiates the same reflex arc that we spoke about last time. So that actually causes the reflex lubrication and the achievement of the orgasm. So away from the pharmacological treatment, nowadays the tibial nerve stimulation is being used widely and still is being studied to encourage the lubrication and the orgasm in the spinal cord and the non-spinal cord injury individual as well. And the risk prevention strategies, like I said before as well, that spinal cord injury means lot of risk, lot of complication. So during the sexual intercourse time, it is very important to uh, the take care of any friction which could be there from the sexual activity, which may damage the skin. And it is very important to inspect the skin at the regular intervals. Irritation to the genitals can increase the risk of vaginal infection, that can again trigger autonomic dyslexia depending upon the level of injury. So yes, if we talk about the physiotherapy, I think it will take more than 20 minutes. So yes, this is a short uh, summary of what I could basically explain on the physiotherapy part. Yes, and as I concluded that Spinal cord injury, the rehabilitation outcomes and the rehabilitation protocols differ from country to country depending upon the social and cultural aspect of that particular country. But it is very important that if all the healthcare professionals of the of the rehabilitation team can be updated on the sexual knowledge, and if they can open up to the patient, that can actually aid in the recovery of the SCI patient. So thank you so much. Thank you. Thank you. Thank you. Thank you so much. Thank you.